Welcome to the Policy Visibility Drive, a Ghana Health Service policy initiative created to enhance the exposure of policies, manuals and guidelines within the health sector. In this video, we shall be focusing on Ghana's National Healthcare Quality Strategy. Healthcare quality was mainstreamed in the mid-2000s with the setup of the Quality Assurance Department in the Institutional Care Division of the Ghana Health Service. Since then, the service has developed a quality assurance strategy, produced a large number of standards, protocols and guidelines, a patient's charter, and multiple editions of the Quality Assurance Manual. Quality is therefore embedded within a larger global movement towards universal health coverage. This is addressed in Sustainable Development Goal 3, which aims to ensure healthy lives and promote well-being for all at all ages. In spite of the numerous quality initiatives implemented in Ghana to date, a culture of quality has not yet been institutionalized in the system. Weak links persist between clinical care and public health at the district level, and unclear oversight and accountability structures have resulted in fragmentation in quality approaches with limited impact on patient experience and health outcomes. Sector agencies work independently without any coordination, and teaching hospitals and private sector players have been largely on the fringes with little involvement and little expectation of accountability. The National Healthcare Quality Strategy articulates a vision with related goals, objectives and strategic interventions built on the WHO and Afro-Health Systems building blocks and measured by specific indicators. Healthcare quality is defined as the degree to which healthcare interventions are in accordance with standards and are safe, efficient, effective, timely, equitable, accessible, client-centered, apply appropriate technology, and result in positive health outcomes provided by an empowered workforce in an enabling environment. Determining the ideal state of quality is a vital step in understanding the current gaps in the current Ghanaian health system and setting forth priorities that align with this vision. At all levels of the health system, the ideal state of quality are organized across the Juran Triology of quality planning, quality control, and quality improvement as follows. Quality planning involves policy, resources, accountability, coordination, and execution. Quality control spans across standards or guidelines, protocols, professional oversight, accreditation, and performance review. Quality improvement speaks to gap analysis, needs assessment, tools and methods to develop, test and measure change, feedback processes, change ideas for improvement, as well as administrative and frontline support to close the gap. Key challenges and hurdles have been identified in the delivery of maternal health services, improving deployment of skilled health workers, supply of medical equipment for birth and post-care, logistics, staff within the medical centers, quality health care and ambulance services were all barriers that threatened the delivery of quality and safe maternal health care. Interventions that contributed to the improvement in these areas were the implementation of the National Health Insurance Scheme, which guaranteed free maternal care and an increase in the number of skilled birth attendants. Over 1 million Ghanaians are considered food insecure and chronically undernourished. About a third of children nationwide are stunted and majority are anemic, both factors that also contribute to under 5 mortality. Malaria remains the biggest cause of mortality and morbidity in Ghana, despite efforts to tackle this disease, with the most vulnerable being children under 5, pregnant women, and the poor. Challenges faced include limited access to and proper use of insecticide-treated mosquito nets, resource limitations for scale-up of malaria programs, poor sanitation, and inadequate waste disposal. Due to socioeconomic and lifestyle changes, the Ghanaian population faces a rising prevalence of non-communicable diseases. Globalization, urbanization, aging population, and weak health systems have also catalyzed the escalating emergence of non-communicable diseases. In 2012, the Mental Health Act was passed, creating a mental health authority tasked with the responsibility to coordinate the delivery of quality mental health care nationwide. This recognizes mental health as an imperative issue to address. However, implementation has been slow, exacerbated by the fact that acknowledgement and treatment of mental health conditions are stigmatized. As such, the following priority areas have been identified for the National Healthcare Quality Strategy to focus on in order to improve the healthcare system and achieve improved health outcomes. Population health priorities. Child health, that is, neonate, infant and under 5. Communicable diseases such as malaria, epidemic-prone diseases, cerebrospinal meningitis, and cholera. Non-communicable diseases such as hypertension and diabetes. Mental health, geriatric care, leadership, governance, accountability, coordination, supervision, and monitoring, data, measurement, data use and learning, human resource for health strengthening, recognition and reward, client and community experience, financing and logistics. If you've liked this video so far, give it a thumbs up and subscribe to the official YouTube channel of the Ghana Health Service. Comment down below to let us know what you think, and click the card above to watch all Policy Visibility Drive videos. Quality Improvement Initiatives. The following quality improvement initiatives have been adopted. The use of quality planning tools to identify performance gaps in systems and processes by managers and frontline staff. Prioritization of critical gaps for interventions. Formation of multidisciplinary improvement teams. Generation and use of innovative, cost-effective solutions, continuous data feedback loops and reflection on data through learning systems, coaching and mentoring follow-ups, capacity building with embedded practical components including on-site activities. The goal of the National Healthcare Quality Strategy is to continuously improve the health and well-being of Ghanaians through the development of a better coordinated health system that places patients and communities at the center of quality care. The strategic objectives of the strategy are to improve the clinical skills of relevant health workers to manage identified priority health interventions, to promote a quality culture and accountability for quality in all health workers and sector agencies, to create sustainable leadership and governance for quality planning, quality control and quality improvement at all levels of the healthcare system, to strengthen coordination among all health sector agencies, to standardize collection of data and improve use and analysis of data at all levels, including by providers at the front line for evidence-based decision-making, to resource and strengthen regulatory agencies to roll out a nationwide accreditation process with clear links to facility-based quality management teams for ongoing improvement actions, to sustain patient safety at all levels of healthcare delivery, to improve client satisfaction and participation in quality definition and quality improvement, to build a culture of joy at work which spans across financing, logistics, recognition, and reward that creates the context for health providers to treat clients with dignity and respect, deliver high-quality care, and be motivated to continuously improve quality. In order to significantly improve the health outcomes in our country, there is the need to improve the coordination of our healthcare system itself in a holistic way that incorporates both the public and private healthcare sectors, partners with patients and providers, and builds continuous feedback loops to improve quality at all levels of the healthcare system. This National Healthcare Quality Strategy built on previous quality initiatives in Ghana and helps to bring these initiatives together under a common goal and approach to quality through a framework of quality planning, quality control, and quality improvement. Please note, this video only contains an abridged version of the policy document or publication. To access the full document or for further reading, kindly visit the Ghana Health Service website at www.ghs.gov.gh. Thank you for your time and attention.